All right, good evening, everyone. It's been more than a month, and so it's time for another data update, but things have not been as urgent. So the data updates are sunnier. It's like a weatherman forecasting that there's going to be more weather. That's what I'm doing right now. The more sunny weather, there's not as much chance to watch it when the clouds are clearing. And I want to say the clouds are indeed clearing. And so I've had some questions and answers from friends that I want to talk about. These are the 4 questions I'm going to answer, and I'm going to talk about basically how are we doing. And I think that we're doing okay. Before, when I answered how are we doing, I want to talk about this as a global sort of phenomenon. And I looked at the U.S. and I compared it to Israel before and the United Kingdom. And I also compared it to Canada. Before I would say that we're doing X and Y by talking about cases, hospitalizations, and deaths. But now I want to say how we're doing by looking at vaccinations. And I want to say Israel has tailed off above 60%, still very high, of course. United Kingdom and United States are catching up to where Israel was, but look at what's happened to Canada. Canada's actually bypassed us all and is vaccinated faster than the other countries, and they are now where Israel is at. So this is as far as the vaccine goes. And the reason why I'm showing you this graph is as the vaccine goes, so goes cases, so goes hospitalizations. And so this is really good news, especially for Canada. United Kingdom and United States, you see it's tailed off recently. And so we've sort of vaccinated all the high-risk people and the people who want to get vaccinated. And now we're dealing with people who can't get vaccinated at some point. Maybe children are a certain 10% of the population that can't get vaccinated. And then there's the people that won't get vaccinated. And so that's what I want to say is we are working on persuading those people to get vaccinated. But what if we tail off where Israel is around 60%? Well, the good news is it looks like Israel's doing okay. And so there's one little fly in the ointment, and that's what's going on in the UK right now. But I'll get to that in a second. For right now, I want to look back at where we were on May 2nd. And I said King County should not go back a phase. It should stay in phase 3, even though the data on May 2nd said that they should, if we live by the letter of the law. But looking at the curve of the data and not living by the letter of the law, I said the exponential growth of this virus is very unlikely. And it was right, looking back. We were at the top of the curve right there. It did go down. Vaccinations really helped. And I said if we follow Israel's path, we'd expect to be where they are at now in about 2 months. And the thing is, I think we're at where Israel was in early May. I think we're at there now, at least as Seattle and Washington State go. And it's only been a little more than 1 month. So I was a little bit conservative in saying this. And so this is all really good news, and the reason why, well, number one, we've done a good job at vaccine rollout, but also the vaccines themselves are working better than we had any right to expect. This new mRNA technology is really amazing, and this is showing up in every country across the globe that's using it. And the reason is, you can look back at the clinical trials, and the clinical trials said that we had 90 to 95% effectiveness. And this is above what I expected. It's above what scientists like Carl Bergstrom expected. You should check out this whole thread because he talks about these different 4 things that he got wrong. One of the things he got wrong was a very good thing to get wrong because he thought the vaccines would max out around 85%. And I thought the same thing. Instead, it's like expecting to get a B in a class, which would be okay, But instead of getting a B, 85%, you get an A, 90%. And so you're very happy with that. This is as good as it can get because the vaccines are so good. They are working really well to get down cases. I have the case data coming up for both countries and Washington State in a few slides. But the question is, you have seen that all these countries are sort of tailing off at around 2/3 of the population vaccinated. And we should know that we'd never get to 100%. There are people who cannot get vaccinated. And we know there's a lot of people who will not, right? So how vulnerable are we, considering that there's this proportion of unvaccinated? And like I've done before, I want to look at Israel because they are ahead of us on this. You see, they flattened out around 60%, but their cases are still cratered, their transmission is still down, deaths, hospitalizations, they're all still down. There's one thing that Israel tells me, it's that hospitalizations in particular are stickier than I thought they would be. It took them longer to come down. If you look at the graphs, the hospitalizations are sort of the last to fall. And I think we see that in our case as well. And that comes from the people who are not at high risk, but moderate risk, not getting the vaccine and then getting infected. So that's where that comes from. But that is... The thing is, when part of the population gets vaccinated, the other population is at risk, but the whole population is diluted enough from transmission that you see a little bit of risk, but you see about the same risk that you had before, and then it starts going down for the unvaccinated. This is what we saw back in early March for Israel, where they had vaccinated 16-year-olds and none below 16-year-olds. So they vaccinated the green line here, and the yellow and blue lines they did not vaccinate. And look what happens after the vaccination happens on the left side of the graph. They were in the middle of an outbreak, so cases actually went up, but then they started crashing once the vaccination really took effect. And the green line went down lower than the blue line and the yellow line. In fact, the blue and yellow line had a little resurgence that happened after the older children went down. And so you see that this is the case, this is what happens to unvaccinated. They are at risk, but they're at about the same risk that they were in the middle of the pandemic, and this is with them having loosened restrictions and things like that. What this says is that they are at risk, but not exponentially more at risk than they were before. The other thing that this doesn't show is that these lines, this is about the peak of those lines. The lines started to go down after that. And so everyone is down now, and the vaccinated are protecting the unvaccinated, even though only about 2/3 of the country has been jabbed. For more examples about how a vaccinated majority is protecting everyone, even the unvaccinated, here's a review that you can look at that collects several examples, certified and all the data about it, that talks about how this actually works. But we were hoping it would happen, and I think it's related to the fact that we have very good vaccines. So looking at what happened to cases, on May 1st I showed this for Israel, dropping straight down on the drop-down graph. United Kingdom also, and then the U.S. was starting to drop down, we hoped. We were worried that we would see a resurgence. We actually had officials saying that they had a sense of impending doom. But instead of impending doom, what we see dropping down. We see Israel dropping down, the U.S. dropping down, Canada's dropping down now. So you see all of these, except for the United Kingdom. You see that there's a spike right there, but see how low they still are. And they are having a spike that's from a more transmissible variant, the Delta variant that's come around there and was imported from India. So there is a bump, but that will, if you look at the other countries, these bumps have happened. And it looks like the kind of bump that I showed in Israel for the unvaccinated. We also know the vaccines are working against the Delta variant. So that's what a lot of people will say. I don't want to go through all the evidence right now, but I do want to say that more transmissible, probably true. But it's only part of the picture. There are countries where the Delta variant is there and it's not exploding. The virus interacts with its environment. And the biggest thing is that in lab tests and in real life, we can see vaccines are still protecting against the Delta variant. This outbreak is being driven, if anything, by the unvaccinated or not fully vaccinated people. So you need both shots to take care of the Delta variant probably, so get both shots. And there's a lot of details about this I can go into, and when you hear bad news about variants, there's something to remember. Usually that bad news has to do with B cells or antibodies. That's the first line of defense. But remember, those will help prevent infection. But after you're infected, there is a second line of defense, T cells. And that line of defense is broader. It's against more parts of the protein. And it's able to actually keep severe disease from happening. So remember, even in these outbreaks in the UK, and I believe we're seeing this with the Delta variant, it is not worse, it is not causing a severity of disease that is exceeding what we had before. If anything, these make it better, or maybe it's about the same. Okay? So remember that this second line of defense means that it's severity that we have to look at, as well as simple infection, whether the virus is in your body at all, whether you are in the hospital because of the virus, it looks like the vaccines, even the ones that are a little bit weaker against certain variants, are still very good at preventing severe disease. And for example, I'm going to go to the third forgotten vaccine. You know, the third child's always forgotten. The third vaccine here is forgotten. The Johnson & Johnson. The Johnson & Johnson still looks very good. Against some variants, the Johnson & Johnson doesn't show up as well in some lab tests. First line of defense is not as good. But if you look at real-life prevention of severe disease, which is what we want, and right here we have the data, there is basically the variants that we're worried about, even variants that take care of, that elude the first line of defense, they only create more moderate or severe COVID by 8% more. There's only 8% reduction in the Johnson & Johnson's ability to protect. This is what immunology is great about. You have to think about, is it good or bad, you know? But what's happening is that we're talking about the variant's ability to elude the Johnson & Johnson, and it is able to elude it, but it's still, the Johnson & Johnson is still preventing moderate or severe disease caused by that variant. Here's the data that you can zoom in on, and you can see those antibody graphs in the upper left, that you see the antibody graph is really low for this, and it's like down on the line. There's a lot of antibody evasion. And yet if you look at the rest of the data, there's still prevention of severe COVID. And that is the most important thing, because these vaccines, even in the case where you have some variant eluding the vaccine is still, for most people, turning COVID into a bad cold. It's not life-threatening anymore. And that's for Johnson & Johnson. The other ones do even better in the lab tests and in real life. So I want to turn to my local area because I've still been collecting the data. So I want to make all that data collection worth it. And I want to say, how is Seattle doing? And so this was the headline today. We are the #1 city in the nation for major cities, however you define that, for being vaccinated. And we are at 70%. Being in Seattle, you're more vaccinated than you are in the whole of Israel, you know, percentage-wise. Now, probably Tel Aviv is probably better than Seattle, so we can probably parse this all day. But the main thing is we're doing very well, and we appear to be at the place where the vaccinated will protect the unvaccinated on the whole. You'll still have some breakthrough infections. You still have, if you have a 95% reduction, you still have a 5% non-reduction, you know? That's not to say that things don't happen, but the vaccines are doing their job, and it looks like we as a society are beating this thing. Here's the graphs that I showed last time for King County, positive cases and hospitalized cases. So see what they've done? Since then, they've just dropped. They've dropped off the table, and you can see that we're going way down. Here is daily confirmed cases, King County in blue, Snohomish County in orange. This was back a month ago. In the past month, you see they've continued to drop. The red lines are the thresholds. We are definitely below the thresholds, and that's one of the reasons why nobody's really even thinking about the phases anymore. Because look at that data. That data is not approaching the red line. Hospitalizations, so you have the red line right there. It's interesting that the hospitalizations are sort of stickier. Like I said, it appears that the moderate at-risk people who do not get vaccinated are still being affected by the epidemic. They can be put in the hospital, but deaths are way down. Some of these people are getting very sick, and so we you know, but overall the answer to this is to vaccinate more. This is where we were, this is where we are. And you see we're definitely below thresholds. Definitely still people catching COVID, and there's a few people dying, but the death rates are really low. And here is the currently hospitalized and on ventilators. This is the one little fly in the ointment bad news I have here, and it's not that bad. When you bring it out to today, you see that ventilator line is still up higher than I'd want it to be. There's only 4 or 5 people in a county of 800,000 who are on ventilators in Snohomish County right now. But you see that actually the line, it looks like these people, this blue line, the ventilator line, is slower to respond to the drop, probably because when people get very sick, then it lingers and it keeps them on the ventilator for a long time. That's how I interpret it, But at the very least, it is very low. It's what the system can handle. And hospitalizations overall are about as low as they ever have been. I believe that this recent peak that we've been through in King and Snow counties is the result of the vaccinated people and then unvaccinated people catching it after the vaccinated people are out and about. It's the same kind of thing we saw in Israel, and the curve even has the same shape. It went up and it went down, just like for the children in Israel who weren't vaccinated. So all these data, these are doing what I hoped. And how are we doing? I think we're doing well. And this is what I want to leave you with. So I want to say, still do what you can to look out for this. There's no reason to take unnecessary risks. But it's not very risky. And it looks like these cohorts, on the whole, as averages, vaccination is working better than I would have expected. I was hoping that we would be back to normal by July 4th, and now we are definitely approaching that. And that's as a nation. In my little corner of the nation, we're doing even better because we've got all these people vaxxed. And so we should still keep an eye on these numbers, but we should see them continue to go down. Variants might happen, but variants are being taken care of by the vaccines. There's really not a way that I can see a variant mutating enough to completely avoid this vaccine. That would require an accumulation of mutations beyond what we've seen. I expect some evasion, some outbreaks, but I don't expect it to be where the whole country is going to shut down. The UK is actually debating this right now, and I don't know where they're going to come out because some people are worried. I would say continue to open based on looking at this data for months and months. Now, nobody's asking me, and so we'll see what happens with the UK. But I think that they are going to be okay. And I hope you're going to be okay too. I think that we have taken care of a lot of the things with this virus, and now we've got a lot of the rest of life to put together. And so we can start thinking about those things. How do we put the other parts of our lives together now that we don't have to keep laser focus on this anymore? The vaccines are working enough to allow us to look at the other parts of our body, mind, and soul that have been neglected over the past year or so. So, my prayers are with you as you do that. And I hope that things go well. I hope I don't have to do another data update. Maybe there will be a variant or something like that. But I don't expect it to be scary. I expect it to be something that we can take care of as a society working together. All right. So I hope you have a good evening and stay healthy. And work on the other parts of life. All right. So see you. I don't know when I'll see you around again, but that's a good thing. All right, have a good night, everyone.